Everyone, how are you? Welcome to another question and answer session. This is the physiology portion of MRCS. A 43 years old lady recovering from intensive care unit following an Whipple procedure, which is one of the big surgery. She has central venous line in situ. Which of the following lead to wide descent of the waveform trace? That means in case of jugulovenous pressure, which of the following waveform it represent the y descent? The options are ventricular contraction, impeding of the right atrium, impeding of the right ventricle, opening of pulmonary valve, and cardiac tamponade. So first of all, let's see the definition of the jugulovenous pulse or jugulovenous pressure. So what is jugulovenous pulse? It is defined as the oscillating top of vertical column of the blood in the right internal jugular vein, and this pressure changes in the right atrium. That means when we see the jugulovenous pressure, actually it represents the right atrial pressure changes. So the right atrium, this event, that means the whole internal jugular venous pressure, it represents the condition of the right atrium. So what is jugulovenous pulse? It is the vertical height of oscillating column of the blood. So first of all, let's see, it is a tracing of the jugulovenous pressure. Here we can see this is the upward deflection, which is the A, C, and B. This 3 is the upward deflection. That means in this time the arterial pressure increase. That means the arterial pressure in this area is increase. But here let's see some downward deflection also, and this downward deflects what represented. This downward reflection is indicated that in this area the arterial pressure decrease. In this pressure, arterial pressure decrease. So first of all, in the JVP there are 3 upward deflection and 2 downward deflection. First of all, the A wave, it represent the arterial contraction. That means when pressure increases in the atrium. So during A wave, A, C, and B wave, in this 3 time pressure increases within the atrium, actually in the right atrium. So when pressure increases in the right atrium, first of all during A wave, and during this time arterial contraction occur. Then C wave, another important wave, and this C wave occurs when there is ventricular contraction. And another one is the V wave. In this period, arterial venous filling. So this is important. The first one, that means the A wave, first one, which is the A wave. This A wave occurs when there is atrial contraction. Then the C wave occurs when there is the ventricular contraction. Actually what occurs, let's see, this is the right atrium and right ventricle. So what occurs, C means the ventricular contraction. So when there is contraction in the ventricle, then no blood comes to the ventricle, and this time also right atrial pressure will increase, because this time tricuspid valve is closed, so pressure within the atrium is increased. And third one is the B wave, which is the atrial venous filling. That means the after relaxation, the atrium, that means the right atrium, after relaxation it fills. So when the blood comes to the right atrium, blood increases and pressure also increases, so it represents V. So A, C, and B, these 3 wave, among them A and B, they are directly event in the right atrium. Here this is the right, in the right atrium there is direct event. That means A for atrial contraction, and during B this time blood filling in the atrium, but during the C wave here contraction of the ventricle causes passive increase of the blood pressure within the right atrium. Then down deflection, one is the X wave, another one is the Y wave. In case of X wave, atrium relaxes and tricuspid valve move downward. So when atrium relax, in this condition the pressure reduces. And the Y descent, when there is ventricular filling. So when there is the ventricular filling occurs, Y descent, when there is the ventricular filling occurs, in this condition when there is ventricular filling occurs, what happens? The blood comes to the right atrium. So blood leaving the right atrium to right ventricle, it causes a reduced pressure in the right atrium. So first of all, what X descent? When there is atrial relaxation here, when there is arterial relaxation. And when Y descent, it occurs when blood comes to the ventricle. Now the details, the A for arterial contraction, A wave, then the C wave is the closure of the tricuspid valve and ventricular contraction. And then the X wave, it is downward movement of tricuspid with ventricular contraction. And V for passive arterial filling, and Y for atrial emptying with opening of the tricuspid valve. So now what denotes the Y descent? During Y descent, what occurs? During Y descent, there ventricular filling occur. So here there is no ventricular filling, but during the ventricular filling, what event occur? This time emptying of the right atrium occur. That means every time we have to remember X and Y descent. So during X and Y descent, we have to find out where the right atrial pressure reduces. So in case of ventricular contraction, there is passive increase of the right atrium, impeding of the right ventricle. That means this time also the contraction of the right ventricle. That means pressure in right ventricular more. Opening of the pulmonary valve, it also the systolic phase of the right ventricle. And cardiac tamponade, in cardiac tamponade there is no such type of the option. So in case of Y descent, it occurs during the filling of the right ventricle or emptying of the right atrium.